My name is Carel Le Roux. I'm an obesity specialist, and we get asked questions frequently regarding obesity. I think the critical response to this is that obesity is a complex and chronic disease that needs chronic treatment. And we have lots of options at the moment. We have options that include nutritional therapies, pharmacotherapies, as well as surgical therapies. And it does not matter which one of these treatments we use to manage obesity, but we must continue to do that in the long term, because these treatments are not weight loss treatments. In fact, they are treatments for the disease of obesity. So if we can control the disease, put it under control, keep it under control in the long term, that is where we get the most health gains for our patients. So the focus needs to shift away from weight loss, but needs to shift to health gain. And that can only be achieved with long-term management. But the modalities that we use can differ between patients. Now, in the past, we used to think about obesity in terms of how tall you are and how much you weigh. And we calculated the body mass index. But this is not a very helpful tool because it tells me not about the amount of fat that sits under the skin or fat that sits around the organs. It also doesn't tell me about the deterioration in health. So we're now using the World Health Organization definition that tells us that we're looking for excess adipose tissue. That means too much fat under the skin or too much fat around the organs. But most importantly, it says excess adipose tissue that causes a deterioration in health. And it's really this latter part that we need to focus on. We need to understand what are the health deteriorations that we need to target. How much weight loss do you need to become healthier? And what are the health targets that's specifically important to you? Now, these health targets may be mechanical, may be joint pains, for example. It can be metabolic, for example, diabetes or high blood pressure, or it can be mental. It can be depression, or it can be a low mood. So it does not matter what the complication is that is involved in obesity. We need to be able to address it in the long term and treat it effectively. That depends from person to person. And we see that even people that are exactly the same height and exactly the same weight, they may develop different complications depending on the type of obesity that they have. We understand that some complications are higher risk when it comes to people dying, for example, from heart attacks. So if somebody develops type 2 diabetes because of their obesity, we know they have a much higher risk of developing heart attacks. So we need to disrupt the diabetes by causing significant weight loss, and we can even turn the clock back. There are other complications that may not be life-threatening, but certainly may reduce your quality of life. And that's really the functional complications. Are you able to sit on the floor and stand up without using both of your hands? Are you able to cut your toenails or put your socks and your shoes on without difficulty? Those functional complications may not threaten your life, but it certainly threatens your quality of life. And what we are able to do is reverse those, improve it in the long term to allow patients not only to live longer, but also to live better. What we want to do is find a treatment that you can be comfortable with for the rest of your life. If we're going to change the way you eat and what you eat, you must be able to enjoy that food for the rest of your life. And that is possible in about 2 in every 10 people. They're able to change what they eat, change how they exercise. It's easy for them. It works for them. They're able to lose substantial amounts of weight and keep it off in the long term. There's about 8 out of 10 people that don't respond to that treatment, and they may have to be elevated or escalated to medication treatments. And we have multiple medications now, really good treatments that's coming down the pipeline that will help patients get control of the disease of obesity. And we now see with these medications that when we treat the disease of obesity, people naturally eat eat less food because they're not thinking about food all the time and they're not preoccupied with what they're going to have for breakfast or lunch or dinner. And therefore, we know that these treatments are really obesity treatments that allows people to get control of the disease and ultimately result in long-term weight loss. We also have surgical treatments. That's really been the mainstay of good weight loss in the long term. Surgical treatments have been the best treatments we've had for obesity for more than 50 years. These treatments are now very safe, they're very effective, and we are now able to help patients choose between nutritional therapies, pharmacotherapies, and surgical therapies to make sure you get the right treatment that's going to work for you and deliver long-term benefits. If you are diagnosed with the disease of obesity, the next steps is to understand whether or not you are prepared to take on board that this is a complex disease that needs treatment for the rest of your life. We are not good enough at the moment to cure the disease of obesity, but we certainly can treat it and control it in the long term. We can achieve that with nutritional therapies, pharmacotherapies, or surgical therapies. Now, you may choose to have a surgical therapy, and if that is the right treatment for you, we can certainly move forward with that. You don't have to have a nutritional therapy or a pharmacotherapy before you have a surgical therapy. You can immediately go to the treatment that you think is the right treatment for you. And the reason for that is that we as doctors don't have a blood test that can tell me which treatment you are going to respond to. So whether or not you choose or I choose, we have the same chances of being right. But my job is to make sure you fully understand the advantages and the disadvantages of each of those treatments. We see that the majority of people still choose to have a nutritional therapy, and that's very safe and can be very effective in about 2 in every 10 people. Other people are now choosing a pharmacotherapy because they may have tried a lot of nutritional therapies in the past. The pharmacotherapies are now very effective, and we can help maybe 7 out of 10 people achieve sustained long-term benefits, provided that they continue to take the medication in the long term. Medications are also very safe and well tolerated, and that helps us with this chronic treatment. Approximately 2 or 3 in 10 people choose to have surgical therapies. Now, those are long-term proven therapies. And of those patients, the vast majority can sustain long-term weight loss. But even in the small minority that may have weight regain, we can help them by combining medication or lifestyle or nutritional therapies to work with the surgical therapies in the long term. We are now confident that we're going to find a solution that's going to help you achieve better control of the disease of obesity. But ultimately, we will not make you thin and we will not make you happy. But what we will do is we will make you much healthier and more functional in the long term.